Welcome to Thai, and this is what we're working on day 2. We're working on joint rotation. So the last class we talked about the 3 rules of thumb and how we work the body, okay? Yes, we always start at the feet and work towards the center, but rule number 1 is we always start with send lines. We warm up the tissues first before we do anything else. And how we do that is we work the energetic body and the physical body as one, right? And we compress and we stimulate, we push the energy towards, we push everything towards the center of the body so that it can be turned about and then released. So we're removing restrictions and whatnot, working the send lines, but the second thing that we do, so rule number 1, work the send lines. We did that yesterday, we palmed them. Today we're going to work on joint rotations along with our send lines. So I've already done send lines, my body's all nice and prepared and ready for me to start doing joint rotations. So when you're working on the feet and doing send lines on the feet, you can also add your joint rotations right after that if you'd like. So once you work send lines in an area, you can then work joint rotations. So I would do ankle rotations. I can either hold on to the foot here. A lot of times too, I like to scoop. I like to take my foot and scoop up my client's foot, and then I can do more concentrated stuff. I can do joint rotations, holding the foot. And if you'll notice, I have my bottom hand around the ankle on both sides. So I'm grasping around as much of the ankle as I can. Why? Because anywhere I have contact, I'm going to be creating friction, and friction is heat. And heat is what we need to heat up the material that the muscles and whatnot are made out of to help them be more pliable, to remove restrictions. So I'm holding around that area, creating support, but also creating heat and rotating. So you can grab the top of the foot here and rotate. You can use your hand, you can use your forearm and your hand, whatever you find works best for getting a full rotation. Nice and slow, okay? So that's ankle rotations. We can also do them bilaterally if we want to. I kind of like the first ones to be more supported, so however you like to do that. The second thing is joint rotations at the hip. So I am going to scoop up, actually, first I want to make sure that my client's arms are out of the way. Oh, you can do jostling here. Okay, you can do jostling in any time you like in Thai. So I like to, so I'll just go right up to the jostling first and do the arms, and then we'll go to the hip. So we have wrist, we can do wrist rotations, okay? I like to have my hands around the joint because it helps heat things up. And then I can jostle. And that's doing something similar to joint rotations. It's helping remove restrictions. It's creating lubrication in the joints. And that is what we're wanting to do. So I'm using my whole body to jostle. And then we can actually, but only when the body is face up, we can jostle and then we can toss that arm. It actually feels pretty good. As verified by my client. She's smiling. Okay, so once I have the arms out of the way, you want to make sure before you start joint rotations on the hips, the arms are not going to obstruct your path. Then I'm going to use my whole entire body, okay, and I'm going to take the foot in my hand, and it would be better if I'm on this side.
Oh, maybe. Yeah.
Okay. So I'm in like a warrior position here. I'm going to scoop up her foot with my hand here and right under the knee. So I'm going to make this circular movement in order to get this foot up with my rocking movement. Okay? So we'll do that again. My whole entire body is moving that leg. I am not picking this leg up and holding it. My whole body is supporting this leg. Okay? So then I take this leg, I can hold it here if I want to, I can put it on my hip and hold it secure, but then I'm going to make circles. So these are hip rotations in which I'm using my whole body and I'm going in different directions. So I can go in one direction, I can go in the other. If your client is doing this movement for you, then you can mix it up until they give up. But that tells us something. When the client is for you, there might be some holding, maybe some sort of injury in that area from the past or whatever. So it's all part of the conversation we're having with the body, right? Listening is the biggest part of this. So when we're moving with the body in this way, we need to make it our whole body, and we need to not be thinking about what happened yesterday or what's going to happen tomorrow. We need to have a nice, clear mind so that we can listen to what's happening with the body. What do the tissues feel like? Where is there clicking? Is there restrictions? And just listen. Listen to what the body is saying and move with that. Another thing that's really important that we actually discussed in the first class, and I'd like to mention, is we work with the breath. The breath helps the body take in nutrients. The breath helps the body expel things that it doesn't need anymore, and restrictions as well. And it can also help relax the nervous system. So our breath is directly linked to the nervous system, and we work with the breath in 3 different ways. You can do it by directing. One, directed breath. Amanda, can you take a deep breath in for me? As she breathes in, I'm going to let her body have some space. As she breathes out, I'm going to go into movement. Because I'm using this movement along with her breath to push things out. I'm moving things towards center line, and I'm pushing things up, but I'm also using her breath. Okay? Another way I can use her breath is I can watch her breathe. I can see her stomach rise, her chest rise. I can watch it fall. So I'll know when she's breathing in and out. And then I can move with her out breath. So she's going to take in stuff. And as she breathes out, I'm going to help her expel things by going into movement. So if you don't want to bug your client, if they look nice and relaxed, and you don't want to direct their breath, you can move with their breath by watching it. Third way, the third thing you can do, is you can sync your own breath up with theirs. So when I have contact with my client, she can feel me breathe too. Her body can feel me breathe. So I might extend my breath, maybe even make it very audible or whatever, but syncing my breath with her breath is another way we can work with the breath. Working slow, working with the breath, and the rhythm rocking down. This is what makes it tie. I'm going to now show you how we would transition using this hip rotation. So this hip rotation is called the helicopter. And I'm going to use it and move with in the direction that I am turning, that I'm rotating the leg. So I'm going to use that movement that I'm creating to move her whole entire body. But first I'm going to move my computer from the way. There we go. Okay. So I've got my client, I'm moving in the direction I obviously want to go that way. So I'm going to move in a circular motion in the direction that I want to go. Moving. Take a nice deep breath in for me. And as she breathes out, I'm going to move her into this sideline position. Here. Okay? Next, I'm going to show you the shoulder rotations. I'm going to come, I'm going to sit next to my client here in closed diamond position. And I have brought my arm underneath hers, and we're cubital fossa to cubital fossa. Okay? I'm going to have my fingers on the acromioclavicular joint right here. And so things are happening. Wherever I have my hands, I'm creating pressure, which is creating friction, which is creating heat, and heating up things all around the shoulder girdle here. Especially at this joint where things get all mucked up. So I have my other hand on her scapular, on her whole entire scapular fossa, infra and supra. So I'm then going to move my whole body in that circular motion. So we have forward and back, we have bamboo, and then we have whirlpool. So the whirlpool is what I'm going to use for this. And I'm going to move in a circle. I can go either direction. I can work with her breath. I can go in either direction. And I'm going to move nice and slow as I'm going around. Nice and slow. I'm listening to what the body is telling me. And then I'm changing direction. I may make my circle small at first and then go bigger. That's an option. Or I might just go nice and slow and big.